Got all the technical gurus now.
Yeah, they need to improve. 30 seconds for TV is too much. I don't know for internet, but for TV is too much.
What is the norm for TV?
Sound. I got sound, Chief. I got sound.
You got sound?
I've got sound now.
You can hear. Okay, hang on. Wait. Mohammed. Okay, wait, guys. Wait, guys. I'm trying to talk to Mohammed. I've muted my phone. I want Mohammed to talk. How to can you get the volume somewhere? Okay. Mohammed.
Wait, Mama, so you're coming okay now, man.
Uyangizwa manje Ndabe.
Ukuba no Ndabe, I know Mohammed.
No, ngikhuluma nawe Ndabe ngithi uyangizwa yini?
Ngiyakuzwa.
Manje phela ungiphenduli manje usuthula ngisezwa manje sengiworried.
Ngiyakuzwa ke manje. Mawuqhubeka lezibhalisi kwakho.
Hayi sofaka into la ngemuva kodwa soyifaka la ngemuva. Mohammed, what did you touch? Mohammed, what did you touch?
I didn't touch anything, Chief. It just found up on me.
Was the ihlalo zi-right so sizofaka ilokuzana la ngemuva sofaka ibhena la ngemuva.
No,
Mohammed ungathinti lutho.
Apha wiki yeza mfethu abantu baxa kwi-COVID awuyeke ihlahla sibuke ihlahla.
Wena Ndabe. Manini uNdabe kodwa ukhalwa ngokuthi is 30 seconds delayed. Uthi 30 30 seconds it is too long 30 seconds for TV.
Idelay kuphi mkhulu? Udelay ini Ndabe isound noma
Akuthi yazi ukuthi ukhuluma ngemuva.
Okay, you know what I need us to test? You lip sync. Yabo man.
Yeah. Musungihleka Ndabe.
Uyahleka. Manje uyahleka Ndabe yindaba.
Angihleki next. Ngifuna lo ubhuti kapisa hlale phansi.
Oh, ufuna hlale phansi.
Right. I think konfirme nabasenzazi laba.
For it.
Ndabe ayipafarish.
Hayi bafarish.
Seqalile ukufaka abantu kunjalo.
Khuluma we baba.
Hayi bafarish ikiye nje mfethu ngiyakubona.
Cha phela ukuthi last week uyagcina sethi ayilokhuze. But ucheckile ukuthi ama 1 band pixel noma u2 point something leni ngiyawufuna. Iyafika lapha. Mohammed, does it go to the 200 pixel something that they want, or because they said that maybe it was one something?
Correct mkhulu. Sedlala ngakudonsa unyawo Ndabe serasa.
Oh, yazi yamazi vele yapayisa.
Mohammed buddy.
Yes sir.
Yeah, I think we've got this one, but I'm still surprised what was happening there.
It was him. It was Mohammed.
No, it was blame me for everything. Went and chatted.
Correct, Mohammed. Thanks, my bro.
No worries, my man. All the best. I'm ready on my side, and yeah, we're good to go.
Okay, sharp.
No, ingofuwa ngithi into yakho. Emisi angasebenzisa le veni. Amthole. Sorry, bafo, ngicela usondela kancane. Kodwa uzoqala ukhuluma no meeting. Wemisi angaqhubeka lezo emva kwalokho bese manje siqedile upremier ngoba bese eqhubeka la u-MEC u-MEC we-education it's got a virtual meeting with national minister so they need to connect on the screen so I was requesting ukuthi colleague law from the office of the MEC education ukuthi masiqeda la we then connect the education part.
Yeah, that's fine.
Yeah.
Thank you.
So
Ngiyakwazi ukuhlala lana.
MEC uzohlala la
Uzohlala.
no izophela lethu I think masiqale ngo-2 exact
Yeah.
izophela by 3 izobe siphelile late
No, it's fine.
and then there's an hour and then after that hour and then there's iyaqala education so MEC can sit
I'm
here.
going to mute here, Mohammed.
No, that should be fine. Because
uthini Mohammed? Mohammed uyathanda ukufitlisha ngale phezulu.
Iyakuphazamisa njengoba ubuka la wena atsho nozobubuka la
Awenza?
Shaya libe big screen.
ibe big screen
Hey, ngibuka ukuthi delay. Yazi ngibuka i-delay.
i-delay yana hayi i-right i-delay just ukuthi bona bebona sisikhiphana ku-clean ku-right ku-connected kuyahamba kuyasetshenzeka
Oh.
vele yabona uma ungabe sishutha kanje vele i-delay ihlezi ikhona ku-YouTube ungabuza nomba
Hey, so usho umuntu ayishoyo 30 seconds.
vele ayizwakali lela ubuka nje isithombe kuphela la it's
Imake
reference
ngayithola ivolume yana?
Hayi ngeke uyithole le volume la izokudistract.
izophazamisa thina abashuthayo iphazamise nabo iphazamise wonke umuntu izoba ngumsindo epicket so la just ukuthi kube khona isithombe then ukuthi kube blank that's what I'm saying then ukuthi kube blank ivele leyanto kuphela rather kube khona lesi sithombe sabo kusetshenzwa la bezibuka ukuthi hayi kuyasetshenzwa then ukuthi kube plain kube mnyama
Ngikhombe indaba phezulu ngikhombe dala
it's fine though in YouTube it delays that
Noma you can then play.
You must
let's
come
say-
link in there.
Yeah, faka isithombe nje kuphela ngoba meyibuka lapho
Uzo-distracted.
ukuthi but I've done this thing long time.
Yeah,
Isithombe.
I can see, yeah. I think we're right there.
Iloko, yabo?
Iloko.
Okay. Yazi into kanjani mkhonto ungakwazi ukunginika i-cable or i-signal lapha kuleya notebook
Yeah.
bese ngiyifake i-cable leyo bese ngiyona isithombe la
Ngale ngeke kwenzeke
KwaZulu-Natal Provincial so I have to be here
You have to be here.
Okay,
The
cool.
limitation here. Or you just turn it off. You don't use
I
it.
will turn it off
Yeah.
because we're trying
It was just yeah.
But it would have been nice.
Aesthetics.
we were just playing around
My
you know?
aesthetics.
That's it would have been very nice.
Yeah. My aesthetics here. Which fanele kube
Phela
la.
iyayidlalela vele hayi ukuthi into enakile yabo
No, but that's it. I'll inciphise lapha ngibona.
ibe ncane
Yeah, maybe leave it like this. Ngoba nje efunda la akakwazi ukulokhuza akaloke ebheka, yabo?
Bazongena abantu abaqale budget. Uthini manje yabo?
Wazongena bachetha beceleni.
Abantu bazongena la.
No, it doesn't matter. Uzokwazi ukudilana leyo issue. Akazokuphazamisela. Moleni. Ngibambe social distance amakhamereni.
social distancing ngiyabonga awuyichazi noma
Oh.
Ngeke bavele.
Cha kunengolele phela mina ngiyazi kahle lokhu la ngibona senisondelene kakhulu. Awusiphe sanitizer
siyadingeka futhi
cha ama-contact
inkosikazi yakho lapho nje wathi ukulila yonke i-TikTok yani yonke-ke nisebenzisa
cha phela into ezalayo ile yawanje wasila mange wathesa lo bhuti engimsolayo nje la siyabuya sonke asigeji
Friends, right? It's too many
social distance yakho angifuni vele engibuza ngaleyo Six. Right. Ya manje kune yini singasondezi lokhu sula ya ngoba manje inkinga yilokhuzana ya woza 1 2 Mohammed, are we still good?
Yeah, we're good. I'm seeing you implementing or you're playing with the mic there at the moment. What I've done is I'm also streaming live onto Facebook. So if I get any comments coming through, I'm going to SMS them and WhatsApp them to you.
But prioritize the journalists, the reporters. As questions come through, we will then respond to them. Yeah.
All right, okay, perfect.
Okay.
All right, thanks, man.
Okay, sure. Colleagues, we can start exactly at 2 o'clock sharp so that we can allow the Minister of Education as well at 4. Dabe? Yeah, ngizama indicate ukuthi we'll start exactly at 2 o'clock sharp.
Exactly at 2 o'clock sharp.
Yeah.
Okay, sharp.
Okay.
Yeah.
Undaba engangikhohlisi ngathi ukuthi konke kuhamba kahle. Bengifuna ukucheck nje siyazi ukuthi siyaqala exactly 2 o'clock ngoba everyone is here now. And then nokuthi ama-questions ushuthi uzongifowardela ngiwabuze from here if there are any questions. Yeah. Okay, okay. All right. I got it all seems good. Yeah, I was checking no ndabeni ngoba abantu bangibona bangikhuluma nje bathi kuhamba kahle konke. We had to change sibuye size la disaster center when i-city hall nayo isihlulile. Isihlulile yeah. Number 1 yeah. I know no kulungile sithi singabonga. So qala exactly 2 o'clock sharp here. Okay, sure. Hi. It's all systems go. disaster management center this time around, not the public works buildings, because confusing. They said we were confusing the enemy. We welcome you to this important media briefing, where we give you an update on COVID-19 related issues in the province of KwaZulu-Natal. Without any further delay, I will hand over to the Honorable Premier, who will take us through the recent developments with regard to our pandemic care as a province. Over to you, Honorable.
Thank you, Mr. Mabaso. Greetings to all of you colleagues. The MEC for Economic Development, Tourism and Environmental Affairs, Leader of Government Business, MEC Dube Ncube, MEC for Health, Ms. Nomagugu Masmilane Zulu, MEC for Education, Mr. KwaZulu-Natal Mishengu, officials from various departments, in particular the Department of Health, Department of Education, Department of Economic Development, Tourism, Environmental Affairs, colleagues who are members of the media, distinguished guests, and those who have connected virtually. We extend our greetings to all of you. We once again welcome you to this media briefing, whose aim is to keep the people of KwaZulu-Natal informed of where we are regarding this invisible enemy that is COVID-19. We wish to begin by sending our condolences as we mark the demise yesterday of two giants in the world of entertainment, acclaimed player-writer Welcome Somi and veteran actress Mary Twala. Mr. Msomi is globally known for his adaptation of the theater play Umabata, which was also an adaptation of Shakespeare's Macbeth. Mr. Msomi received a Lifetime Achievement Award for theater from the Art and Culture Trust in 2012. And he was a chairperson of the Living Legend program and had also served on various boards here in KwaZulu-Natal. During her distinguished career as an entertainer, Mary Twala acted in a number of productions such as Sarafina, Hlala Kwabafileyo, Yizo Yizo, Mvwango, and Generation. It is iconic that she passed away yesterday on what would have been the birthday of her equal famous late husband, Ndaba Mhlongo. Together as a couple, the Mhlongos were part of a golden generation of actors who used their art to help South Africans escape the pain and brutality of apartheid, even if temporarily. To underscore the richness of her talent, Mary Twala was nominated for an African Movie Academy Award for Best Actress in a supporting role for a movie called Taxi to Soweto, and also received the Esteemed Order of Ikamanga from President Cyril Ramaphosa in 2019. We say, may their soul rest in peace. Fellow colleagues, yesterday marked exactly 100 days since the implementation of the lockdown and the country's two COVID-19 deaths in South Africa. This occurred in Western Cape, the deaths, and were announced on the 26th of March 2020. A lot has happened since then. The country has conducted 1.7 million tests with a total of 124 positive cases, 2,952 deaths, and 86,298 recoveries. Whereas last Sunday, here in our province had registered 7,786 confirmed COVID cases, with 112 deaths and 3,417 recoveries. These figures have over the past week alone grown exponentially, and today the positive cases stands at 13,984, and that shows a serious and a drastic increase. The deaths are at 182 with 4,197 recoveries. This presents the biggest jump to date, which once again bears testimony to the fact that we are well and truly on our way toward reaching our peak of COVID-19 in the province and indeed in the country as a whole. The impact on resources, the growth in the number of patients who had to be admitted after getting tested has resulted in a high COVID-19 bed occupancy rate, which currently stands at 10% of active cases. About 29% of these comes from the public health facilities, and 71 are located in the private sector hospitals. On the 4th of July 2020, the province had 977 patients admitted in both private and public hospitals, 694 in private and 283 in public hospital. A total number of 120 patients were admitted in intensive care units in both public and private facilities. Of those admitted in ICU, 37% were ventilated. A total number of 160 patients were admitted in high care unit in both facilities, which is private and public. With regard to the capacity at field hospitals, we have the field hospitals, which are Montclair Lodge, which deals with isolation. It has 156 capacity, and only 3 are there. Coastland, Durban, quarantine, it's for quarantining, 250, and 15 is occupied. The capacity is 250. City Lodge, Durban, quarantining, and the capacity is 140, but currently only 11 is occupied. City Lodge, Umhlanga, we have 163 bed capacity, none is occupied. Coastlands, Umhlanga for quarantine, 136, and there is no occupation. Then in Pietermaritzburg Showground, isolation, we've got a bed capacity of 254, but only 20 are occupied as yet. So provincially, with regard to field hospitals, our capacity is 1,099, but for now, the occupation is around 49. Available is 1,053. Now we are trying to detail this so that we will all understand the readiness of the province to deal with any escalation if it were to happen. With regard to hotspots and trends, eThekwini district has the highest infection rate of about 135 cases per 100,000 people. And it is followed by Umgungundlovu district. Umgungundlovu district has drastic increase in incident rates from 26 to 125 per 100,000 population in a period of 11 days. In fact, recently, Umgungundlovu district has been reporting more cases than Ilembe district. Umkhanyakude is the only district with less than 10 cases per 100,000 population provincially. With regard to the breakdown of the cases and deaths, at eThekwini, we have the new cases in this period are 578, which is the 47%. The total number of cases in eThekwini is 7,666, and the deaths in eThekwini is 128. In Ilembe, the new cases are 51, and the total number of cases now in Ilembe, it's 1,054. The deaths in Ilembe are 8. In Umkungundlovu, the new cases in Umkungundlovu are 239, and the total number of cases since the beginning of COVID-19 is 1,833. The deaths stands at 8 in Umkungundlovu. In Uthukela, new cases are 39, and the total number of cases is 613, and the deaths is 13. In King Cetshwayo, 94 cases. The total is 625, and the deaths are 5. In Ugu, 68 cases. The 68 new cases, and the total number of cases, all cases, is 525, and the deaths are 6. Amajuba district, 45 new cases and 393 cases altogether, and 1 death. In Umkhanyakude, 10 new cases. The total number of cases in Umkhanyakude is 128, and there are 3 deaths that have taken place. In Herigwala district, the new cases are 24, and the total number of cases is 288, and there are 8 deaths. In Zululand district, the new cases are 40, and the total number of cases is 252, and there are 2 deaths. In Umzinyathi, 20 cases, and the total number of cases 182. There is no death in Umzinyathi. The total number of new cases in KwaZulu-Natal from last week to now is then 1,227. numbers. It's 1,227. And the total number of cases altogether, provincially, it is 13,984. And the deaths stand, unfortunately, at 182, which is quite a serious number, and it is worrying us. We have absorbed with extreme worry a number of incidents in which people appear to be in denial about the very existence of coronavirus. This is merely on the basis that they do not know anyone who has died because of this disease. We want to strongly denounce this kind of thinking because it poses the risk of increasing the rate of transmission due to reckless behavior. COVID-19 is here, and we all need to be vigilant. It is deadly, and will cause unprecedented devastation if we do not change the way we behave. In terms of distribution of the patients by age and sex, female cases continues to dominate with more than half of the confirmed cases. In terms of the all cases that we have, 56% are female. Among the new cases received on the 4th of July, female cases dominated at 57 cases. Male cases peak between the age of 25 to 39, while female cases are between the age of 25 to 49. Laboratory status in the province of KwaZulu-Natal: of the 1,227 new cases reported on the 4th of July, private laboratories confirmed 74% of these cases. The overall proportion of cases confirmed by private laboratories were 63. Fatalities: the province recorded 4 new COVID-19 related deaths on the 4th of July. Hence, a total number of deaths stand at 182 as reported on all 11 districts. eThekwini municipality contributes 70% of the reported deaths. The age for deaths is around 62 if you examine. But male patients continues to dominate the fatalities at 52%. We have lost 95 males due to COVID-19 related diseases. The proportion of death in female patients increases daily. Deceased female patients dominate in those age of 81 years and above. In terms of comorbidities, the most common recorded comorbidities among the deceased include hypertension, which is 31%, and diabetes, which is 32%. A total of 16 deceased patients were reported to have had HIV positive. The number of deceased patients with no recorded comorbidity is also increasing. In terms of recoveries, the overall proportion of recoveries for the province is 33%. In terms of actual numbers, the KwaZulu-Natal province managed to identify, in terms of contact tracing, we have managed to identify 20,316 contacts to date. The province managed to monitor more than 90% of identified contact. And in terms of the actual number, we have managed to identify 20,300 contacts. Of the total monitored contact, 99% had their specimen collected, and the positivity rate is 4.7%. In terms of the economic impact, the COVID-19 pandemic has affected various economic agents, including enterprises, households, and individuals in an unprecedented manner. The easing of the lockdown restriction to level 3 has brought some kind of relief that has seen increase in the economic activities across various sectors of the economy in the province. This development will tone down the otherwise huge effect of the lockdown that had since started filtering to the national economic data, as recently reported in the GDP and the employment statistic data that have been released by State SA. The GDP contracted by 2% in the first quarter of 2020, whilst the rate of joblessness increased to 30.1 for the country as a whole and for KwaZulu-Natal. Although it is encouraging to observe that most businesses are adhering to the health protocols that have been put in place by the government. We are once again concerned about reports of individuals who are not adhering to social distancing and other health protocols. These include the failure on the side of some of our people to adhere to wearing of masks and hand sanitization. And these are crucial protocols in the fight against this invisible pandemic. In order to better understand the challenges and the needs of various business sectors within the province, the Department of Economic Development, Tourism and Environmental Affairs Executive Authority conduct weekly engagements with selected sectoral and industry representatives. The weekly engagements have been complemented by a provincial survey to establish an evidence-based understanding on the effect of COVID-19 on the provincial business spectrum. The survey confirmed that at a high level, some of the top challenges confronting business in the province include the following: cancellation or reduction of orders due to subdued demand on the back of low levels of income among the people, a considerable number of whom have not been working during the lockdown levels, and that is level 5 and 4. The other reason is that a substantial part of the population are still skeptical about venturing in public due to fear of contracting the deadly virus. Cash flow constraints is also one of the most challenges that have emerged. Most companies have reported that the eligibility criteria for the most relief funds offered by our government exclude a number of them, further worsening their cash flow position. In cases where business establishments have accessed the government relief fund, they have reported that the funding instruments are not agile enough to respond to the real and immediate business challenges. The third challenge, a number of businesses reported difficulties relating to employees contracting the COVID-19 virus, compelling them to further shut down for a process of disinfection in their buildings. This negatively affects productivity, at the same time creating heightened safety anxiety among other staff members. Most companies are facing closure, and we are seeing spike in Section 189 processes of retrenchment. And this is one of the painful challenges that we are experiencing due to this COVID-19 pandemic. With regard to the issue of back-to-school arrangement, the number of infected individuals in our schools is increasing. This week, the number of reported positive cases is at 429, which is an increase of 242 from the 118 cases we reported last week. The new figures include 306 teachers, 81 learners, and 42 other employees of the Department of Education. Umkungundlovu remains the hardest hit district with about 93 positive cases affecting schools. The breakdown per district in terms of challenges of COVID-19 in schools will be as follows. Amajuba, they have 13 cases, and those 13 cases, it's 8 teachers and 5 learners. Erikwala, 33 cases. Ilembe, 33 cases. King Tejwayo, 10 cases. Pinetown District, 66 cases. Umkungundlovu, 41 cases. Ugu 41 cases, Umkungundlovu 93, Umkanyagude 8 cases, Umlazi 51 cases, Umzinyathi 29 cases, Utukela 19 cases, and Zululand it's 29. Now, the total number of cases that have been reported in schools is 429, and out of that 429, 306 are teachers and 81 are learners. 42 are the employees in administration and in those who are part of programs that are provided in schools. We are saddened to announce that 5 of employees from the Department of Education have succumbed to COVID-19. There are 2 teachers from Zululand, 1 teacher from Umzinyathi, and 1 teacher from Umlazi, and a security guard from Ilembe. The total number of affected schools is currently 345 schools in the province. The good news is that 236 schools have returned to full operations after all due processes were followed. Other 70 schools are ready to receive teachers and learners back tomorrow for teaching and learning. The 39 schools that reported positive cases on July 2 and 3 are expected to return to normal by not later than Wednesday of this week. It is expected that new cases will keep coming, forcing some schools to take a break while dealing with issues of screening, testing, and decontamination. The department will release a protocol on Monday to further clarify steps to be followed when positive cases are reported in schools. This will bring uniformity in the manner the entire education department will deal with both suspected and positive cases, as it is important that at such times to maintain stability, we need to create standards, but also we need to ensure that we address anxiety and confusion among people. We'll also encourage departments to maximize their cooperation in addressing challenges emanating from this pandemic. In terms of additional grades returning to school on the 6th of July, the Minister of the Department of Basic Education, Honorable Angie Mutsecha, on Thursday the 2nd of July, hosted the Council of Education Ministers, which then agreed on the grades that will return to schools tomorrow, and subsequent other grades at a later stage. That decision was reached after careful considerations of all factors presented. The national decision was that grades 6, 11, and R will return to school on Monday, the 6th of July. However, KwaZulu-Natal have opted to delay the return of grade R to school until a later date that will be communicated in due course. In preparation for the returning grades, the department has purchased additional COVID-19 essentials. The department has also a challenge of ensuring that both learners and teachers who have underlying health conditions are protected from the virus. Necessary measures have been put in place to support the learners and teachers. Measures are in place to ensure that there will be no classes without a teacher. So there will be no class in all schools without a teacher. With regard to infrastructure update, In light of COVID-19 pandemic, the Department of Education continues to ensure proper water supply to all schools throughout the province. 3,429 water tankers have been provided to schools. Further, as part of health promotion to minimize health risk in schools, the department has a responsibility to ensure that schools have sufficient sanitization facilities. 1,060 toilets have been provided to schools after an audit. The dislodging program in rural areas is also implemented and monitored. With regard to nutrition program, as more grades return to schools, the department is ready to provide all learners with nutritious meal as prescribed. In addition, the department has put in place systems to provide meals even to learners who will not be returning to schools tomorrow. There are 2.34 million learners from 5,344 schools who are the beneficiaries of this program. The department has taken necessary precautions to prevent the spread of virus while preparing and serving meals to learners. Food handlers have been trained in the prevention of COVID-19 spread, and the necessary PPEs have been delivered to all schools. As KwaZulu-Natal, in terms of our own situation and advancing going forward, as grimy as the current statistics are, the curve have not yet exceeded the projected prevalence and bed occupancy rate. However, we must hasten to emphasize once again that we are now in the eye of the storm. It is vital that we abide by the regulations and take all the necessary safety precautions. We should at all times be mindful of our safety during social interaction and adhere to protocols such as avoiding large gathering, practice social distancing of at least 1.5 meters, wash our hands regularly with soap and water or use sanitizer, not to shake hands and to cover our nose and mouth when we sneeze with elbow. It is important that we emphasize these protocols. What do we do if someone tests positive? If someone tests positive in the workplace, we must not panic. Let us contact the National Institute for Communicable Diseases on their toll-free number, which is 0800-299, or the provincial hotline number, which is 033-846-6000. We also use a WhatsApp number, which is 060-0123-456. Now, we want to emphasize the point that it is in our hands, as the government will continue to do everything we can to educate and create an awareness to further ensure that we provide all needed medical support, bed capacity, and everything that is expected. But it is now a responsibility of each and every citizen to ensure that he or she is protected and protect others. So we all carry an equal responsibility. It is in our hands as the people of KwaZulu-Natal. I thank you.
Thank you very much, Honorable Premier. Can we take the question to start with the colleagues that are here physically, and then take those that are waiting on other platforms? Can I get an indication of that? Number one.
chief architect of the town. This past week there has been a protest in regards to the provision of ASI and my PPE. A memorandum was held. So what I wanted to know is if the matter demands, if MEC has seen them and if she engaged with the unions or anyone who's dealing with the matter.
Thank you very much. Sheila?
Thanks. Owami umbuzo wokuqala ngizobhekisa ku-MEC for Economic Development. Lana kunabantu abasebenzayo kunabantu abasebenzayo emafemini abakhompleyinayo ngokuthi abaqashi ababanakekeli, ababanikezi zonke izinto ey'fanele, bayasebenza and kuba khona nabantu abatholakala begula bengatholi ukuthi batheste. Then omunye umbuzo wesibili ukuthi kunabanye abaqashi abaye bayekisa abantu abasebenzayo emsebenzini yabo roundabout ngabo-March, kodwa kutholakala ukuthi one, ababanikezi iy'ncwadi ze-retrenchment, okwesibili kwayona i-UIF abayitholi. Naw umbuzo wami ukuthi mhlawumbe yini into esingayenza njengabantu bey'ndaba ukuthi sibasize abantu, sibatshele ukuthi bangenza kanjani kuleso simo esinjalo. And then bese kuthi omunye umbuzo wami ngibhekise mhlawumbe angathi kundunankulu ngoba akekho u-MEC for transport. Kunenkinga lana, abantu ematekisini bakhala ngokuthi kuyagcwala. Amateksi alayisha 100%, ikakhulukazi ey'ndaweni eziya ngasemakhaya la kungekho khona ukunakwa kakhulu noma ukugadwa kakhulu ngenxa yamaphoyisa. Manje bayasaba ukuthi bazongenwa izifo ngoba osomatekisi akukho ukuthi bagade, bayazenzela nje, impilo zabo zisengcupheni. Then bese kuba omunye umbuzo wami engizobhekisa ku-MEC for Education. Lana sesithole kaningi imiyalezo yokuthi iy'ngane ziyabuyela esikoleni noma ziyabuyela noma zibe zingabuyeli. Manje into engifisa ukuyazi, ngiyazi ukuthi ngoLwesine uMinister for Education wahlangana nabo bonke MEC from different provinces. Kwawukuthi kwakuphuma isinqumo sokuthi ugrade R nabanye amagrade amabili bazobuyela esikoleni and the rest will remain until further notice. Now into engifuna ukuyibuza ukuthi ngabe abazali niyaba-involva yindaba ngoba kunabazali nabo abakhathazekile. Ngabe nina niyinodwa niyiphathimandla noma niyuhulumeni nimane niyithathele iy'nqumo niyinodwa, ningahlangani nabazali ukuthi kubonakale ukuthi ikuphi bona abakubona kubalulekile. Hence kulokuqhamuka lezi zinto lezi ukuthi bayabuyela abantwana noma babuyeli.
Okay, thank you very much. Khalid?
It's Katie from Marketing. I just want to know, there's been a lot of talk on certain areas being put on a harsher lockdown. Is that possible for KZN, and which areas would we be looking at?
Okay. Just to add to the panel so that they can answer comprehensively. There's another one from SABC, Ireland Tom, Omilo, I should start with Eyewitness News, postcard, who was asking the question that the recovery rate is now sitting at 30%. At some point, it was above the national average. Has the department ascertained the reason behind the decrease in the recovery rate percentage-wise? And then Ayanda is asking the question to the Premier. Government has been making a plea for people
Gentlemen, I think I only have about 2 questions that I need to respond to. The first one relates to the issue of infections of health workers in Chief Albert Lutuli. And I think we did the same thing last week. We would rather not focus on one hospital, but raise our concern in relation to infections of health workers generally. Because we see a trend where health workers across the province, and probably not just in the province, in the country, are getting infected. And this is where we are saying it's necessary for us to ensure that the protocols that have been put in place should be adhered to, both by our health workers and by the management. And as I indicated in last week's meeting, we've had a session with the unions where we agreed on protocols that were going to be implemented, and among those was an issue of re-establishing an officer that's going to be responsible for the management or for the implementation of the protocols. Now, this OHS officer will make sure that they walk around the facility and ensure that management is doing what they are supposed to be doing in terms of providing the proper protocols, following proper protocols, ensuring that PPEs are given to staff as they should be given, but also ensure that our health workers themselves wear the PPE properly and they adhere to the protocols of sitting around or of engaging with each other within the facility, because we have found that is one of our biggest challenges as well. The fact that our health workers from time to time, they will congregate together, but when they are outside of the ordinary wards, sometimes a mentality that they are not going to be infected because their health workers prevail. So we are also speaking to our health workers that they must remember they are part of the society, they are part of the community where the infection is spreading. While they take care of themselves when they are actually taking care of the patients, but they also need to follow protocols of wearing masks, washing their hands, observing social distancing among themselves, because you will never know when we are sitting around here who has been exposed and who hasn't. And we have found that that is where the issue, the biggest challenge is. And we've agreed that we are going to go back to all our facilities, start demarcating even in areas where our health workers are sitting and are eating. Now, that is a broad principle that we have taken in the whole province, and we have started establishing, and we've started implementing it last week. It's a similar thing that's going to have to happen at Chief Albert Lutuli. However, we have also realized that the numbers at Chief Albert Lutuli are tremendously high, and they are going up. So we've decided that we have actually started instituting a focused investigation starting from Thursday that's going to look at what is actually happening in Chief Albert Lutuli specifically and be able to deal with the issues there. Having said that, it is very disheartening that when we speak about the issue of the virus that is infecting and our health workers being infected in Chief Albert Lutuli, but we found them standing around at the gate, all of them in one space congregating. It means, by the way, by Wednesday next week, we are going to have even higher numbers from that particular facility, purely on the basis that they themselves are saying they are infected, but they don't have a problem with sitting around and talking to each other and toying around the gate when there's more than 200 of them. So that is a serious one. While we appreciate the responsibility while we appreciate that workers have a right to stand up for their rights, and we support them very much. But at this time, we think there's a better way of handling it, and standing around and congregating in one setup when we are saying amongst ourselves we are so infected, but we must then stand together and still continue to infect each other even more is a problem. So this is a matter that we are taking on. I must also indicate that about a week or so back, we received a complaint from Chief Albert Lutuli, a specific complaint that was saying, maybe let me start by saying we don't have a problem of a shortage of PPE in Chief Albert Lutuli. Chief Albert Lutuli, like any other hospital in the district or in the Metro of eThekwini, has sufficient PPE. However, we received a specific request from Chief Albert Lutuli Hospital where they were insisting that they wanted a specific kind of PPE that is not in the NICD guidelines.
And we had to sit down and explain to them that they themselves, like any other health worker in eThekwini, are supposed to be given PPE that covers them, and it covers them in a particular way. By the way, the guidelines of NICD are specific that when you are in this particular risk area, this is what you must be given. But as you go higher and you get more exposed, this is what you are given. And they have been given that kind of PPE. However, they believe it's not sufficient because they got advice from a particular doctor elsewhere that they should be given something that is different. Now, that can't happen. It just can't happen because all our health workers in the whole province should be treated equally. There is no health worker that should be given a specific preferential treatment. But the kind of equipment that they are also looking for is not something that as a Department of Health generally we buy. And the head of department, by the way, last week went and met with the health workers that were raising this issue, and he was able to clarify the matter, and when they were done, we thought that the matter had been dealt with. Having said that, we will still investigate if there are any other issues that need us to focus on, and we'll be able to change the situation if it's necessary, if there has been any wrongdoing on the side of the management. In relation to the recovery rate, yes, Unkoskona is correct. Right now, we are just above 30% in the recovery rate, and the question is why. We must remember that it's only in the past 14 days that as a province of KwaZulu-Natal, we started getting higher numbers. Therefore, those higher numbers that we started getting 14 days ago would not have recovered by now, because the recovery time of anyone who has been infected is about 14 days or so. So we believe that once we move towards the end of July, our recovery rate would have gone up and would have caught on with our infections. I mean, early June, we were very, very low in terms of infection. It's only around the 7th that our numbers started doubling up, because that is when that is when people started mingling a lot, especially when the lockdown regulations for level 3 were reduced a little bit. So that's why you see that our numbers are only started going up around the 14th. So around the end of July, we believe that our numbers would have caught on with, our recovery numbers would have caught on with actually our infections. Thank you very much. I think those were the two questions.
Okay, thank you so much, Mr. Premier, and greetings to everyone and the viewers. On the first question, whether we involve parents in decision making, yes, we do, through the Association of School Governing Bodies, because parents in the schooling setup, it's them who elect SGBs as their representatives, and SGBs affiliates to different associations. So at a national level, all SGB associations are consulted and are part of decision making, just like the rest of the stakeholders, the unions and other stakeholders in the sector. Even at a provincial level, we do consult all the recognized SGB associations. The last meeting was yesterday morning, where we're taking them through developments since the CEM meeting. So indeed, we do consult the structures and bodies that represent parents. We have, however, seen a strange phenomenon in the areas of Phoenix, Chatsworth, I think, and Merebank, where certain members of SGPs in different schools around those areas have grouped themselves into what now they call an SGP forum. It's something that it's the first time we hear about. And they seem to have mandated themselves as instigators of closure of schools. So they issue out calls to parents to not to send kids to the schools, to issue out calls to close the schools and all of that. We have engaged them, and some of them have retreated, have actually said probably we may have misunderstood them, because theirs was to check if we can reconsider the decision as a department, but they are not part of those who are saying parents must not send kids to school and all of those things. So there are some that after the engagement we have had with them have actually said, no, we understand the position and the decision of the department, that as SGPs were part of the management within the sector. So SGPs actually should be working with us in terms of managing the schools, particularly against, during this particular period. So we are saying there shouldn't be anyone who instigates parents or any members of society to rebel against the decision that has been taken. The minister has been clear that there is no parent who is forced to send the child to school. So if, as a parent, you think that it is not safe for you to send your child to school, it is within your right not to send the child to school, but you must follow due processes of the law. That includes applying for exemption. The HOD has authority to grant exemption under certain circumstances. It also includes you now registering for homeschooling, and we have made public all those processes that are available for parents or to parents who decide not to send their kids to schools. But we want to be emphatic that we remain opposed to anyone who instigates the rebellion against the decision. We are open in terms of engagements, and most of in fact, all the decisions that we have taken are a product of thorough engagements. Together with the unions, together with the SGP associations, we came to a decision that it is better to open schools. The debate has really been on the state of readiness of different schools across the country and in our province in particular. So, indeed, all stakeholders in the sector are consulted. On the question of the water and sanitation, what is the situation now? Particularly on the chemical toilets or pollution facilities. Let me start with that to say we work according to the information we receive from schools, circuits, districts. And in terms of the information that was given to head office was that across the province, we needed 1,060 chemical toilets to basically compensate for areas where we still have pit latrines, because that program has also been hindered by the challenges of COVID-19 and as well as the lockdown. And all these 1,060 chemical toilets have been provided to all the identified and affected schools. So we don't expect a challenge on this one. Obviously, there are instances where a school basically just have to clean a toilet, and it's within the school ambit really to do that. So there will be schools where we'll get photos to say these toilets are not in a state, in a proper state to be used. And when we check, the toilets are functional. It's just that they need to be cleaned, and the school, for some reason, has not cleaned them as such toilets. So we're dealing with such cases. But in terms of the number that was given to us, we have provided all of them. Equally, in terms of the water tanks, I think there were only 5 as at yesterday that were still outstanding, and I'm sure by end of today they would have been completed. The problem with water is now the erratic manner in which water gets provided into schools because of the capacity challenges of our municipalities. There are areas where obviously communities help themselves with water in school. So we wake up the following day, there's no more water in school or in a particular school, and it will probably take another day or two for the municipality to send water to school, because what we have realized that our municipalities across the province are unable to meet the demand of sending water to school in terms of our timelines and schedule, because they still have to service communities. And that is the problem now that we're dealing with in terms of water. We're trying to mobilize more capacity so that at least all our schools, there's not a single day where a particular school in the province is without water. On the last question of delivery of PPEs for the returning grades, delivery started on Friday. I must indicate that there were delays in terms of finalizing the process because I'm sure by now you all know that we have to be pre-audited by Department of by Treasury before we can issue any other order insofar as the procurement of COVID-19 essentials is concerned. And that process between the Department of Education and Treasury took more than expected, but we have started delivering, and in all districts, PPEs, which masks in particular, were delivered to all districts on Friday, then delivered to schools as well as second offices in certain instances started tomorrow. Yesterday, not tomorrow, started yesterday. And we are expecting that most districts will be completing today. Those that will be outstanding, surely by tomorrow morning we should be completing, so that when learners go back home, they go back with a set of two masks. We are experiencing a challenge in two districts, which is Umlazi as well as Pinetown, because of some people who say they are representing business forums. They are demanding that they get work to procure and produce these PPEs, to deliver them and all of that. And they've been really disruptive. So if you get a report to say in Pinetown and Umlazi the delivery rate is low, you must understand that it's because of that. And our view is that these are not genuine business people. We're dealing with extortionists, people who want to benefit through perverted ways. Government is open to do business with everyone. And when we procure as government, we open up. There were 662 people who responded to the tender that was issued for PPEs. But they decided not to follow that process because they believe they have power to strong arm government to a particular direction. They believe that they will simply go to site and demand that is either you give us work or you give us percentage of what we have been paid in the work that we do. And you can't have a state that will be undermined by such people. We have taken an approach to say the police must intervene. We have been in touch with the MEC for community safety in the province, and already police have started to intervene, and I'm sure tomorrow we'll be finalizing the process. We're lucky also, Mr. Premier, that there's also SNDF available. So we just want to send a message to say government will not be extorted, and they will not allow that. But we also want to call on credible, genuine business people to rise against this phenomenon, because it's a phenomenon that is disruptive. We're dealing with people who have no interest of the future of our country, because if you disrupt education, you are disrupting the future of our country. So the government will not be undermined by such people, but also we're calling on the society to rebel against this kind of a phenomenon. Business people must also stand up and say, not in our names. Let business people do business fairly and transparently with government or any other sector. But I want to assure the public that Pinetown and Umlazi districts tomorrow again will be finalizing delivery to all our schools insofar as PPEs are concerned. Thank you so much.
Thank you. On the question of the factory workers that are complaining about not being given the proper PPEs, we have been dealing with a number of complaints that we do get from people that work in various companies, and indeed we do respond to all those complaints that we received from people that work in different companies. We have sent our teams, and we do send our teams immediately when we do get those complaints that the staff is not being given maybe the masks, or there is no sanitization, or they are not being listened to. And I must say that we've also have a very good relations with the Department of Health at the provincial level as well as in the district level, where they have been very responsive, where there are matters in various factories where we do receive complaints from the workers that might say, we are suspecting that there's a case here and the employers are not listening to us, or we think somebody needs to take a look at this case. The Department of Health has been able to go in those factories with us, and we are able to then respond. In many instances, we find that sometimes it's not because those employers do not want to respond. Sometimes it's due to lack of understanding on what to do in case of a case that is reported. Remember what is normally said by the Department of Health and by the Premier every time he makes those reports is that COVID is transported by us. So when we get to the workplace and we display sometimes the symptoms, and we've been told now and again that perhaps it is important that you do not report to work, maybe rather go to the Occupational Health and Safety Office and then report that you are suspecting yourself. If maybe you're worried that if you stay away from work, maybe you might be disciplined, or maybe you might lose your job. And we've then find that employers do not know what to do in case they're confronted by that particular case. So we then are able to get the Department of Health, who then are able to bring everybody on board. We then advise the employers what to do in case of a case, what to do, what protocols to follow, and how to manage that particular instance, but also what to do, because you'll find that the company has got different departments, or FM is divided into different sections, and how do you go about dealing with that case, and how do you ensure that you communicate with the rest of the workers and manage the situation, as it were. So we are really supporting a lot of business people in dealing with the issues that are appearing within the work, with the workplace. The issues of, abasebenzi esithola inkinga zokuthi kunabaqashi abangafuni ukulalela imlayelo kahulumeni noma bangafuni ukuhambisana nomthetho wokuthi banikeze abasebenzi izinto zokuzivikela ezifana nama-sanitizer noba nezitsipho zokuthi bageze izandla nento zokuzivikela. Sikwazile-ke ukuthi uma ngabe abasebenzi besifonela siyakwazi ukuya khona ezinkampanini sikhulume nabaqashi nabo abasebenzi, siyakwazi futhi ukuthi sisize ukuhlanganisa abasebenzi nabaqashi ukuthi kukhulunyiswane, sibasize nabaqashi ukuthi baqwashiswe ukuthi uma ngabe kukhona i-case ekhona emsebenzini udila kanjani nayo njengomqashi ukuze kube nokuthula emsebenzini, kodwa ukuze futhi kungabi khona ukuhlukumezeka kwabasebenzi emsebenzini, uthola ukuthi sekutheleleka abantu abaningi ngenxa yokuthi mhlambe umqashi akakwazanga ukuthi i-case ereportwayo ayilalele noma abalaleli abasebenzi. Udaba lama-retrenchments Njengoba uNdunankulu eshilo ukuthi we are now meeting with various sectors of the businesses almost daily, every week. We have been having these meetings and they are very useful in the whole of the province because we have been taking stock of each and every sector as to how many people are retrenching, how many in those companies people have been retrenched, and where are those people that have been retrenched, what is happening in that particular sector. And we have also insisted that they need to follow the law if there are retrenchments. What we're also doing now is that we're keeping records of those people that are getting retrenched with a view of looking at various avenues that are available, such as the reskilling, the retraining of those, because we do have partnership with the UIF of the unemployment insurance program, where people get reskilled and they are able to get into various sectors of the economy. We also have raised the issue of the UIF. There are huge backlogs within the UIF office. Dlulisele emnyangweni ophezulu kwi-head office kwi-commissioner udaba le-UIF. Sinoluhlu olude lwey'nkampani olungakatholi i-UIF imali yakhona abasebenzi kusukela ngoMeyi nje kukhona abangayitholi ngeshiya kaMeyi. So sesilisukumele impela njengesifundazwe lolu daba lakwa-UIF kusukela nje kusasa sizawube si busy ne-commissioner sidila nalo lolu daba ukuthi yini ngempela eimbangele ukuthi kube ne-backlog engaka nanokuthi yini engenziwa ukuthi abantu bangahlukumezeki ngalolu hlobo lokuthi bahlale bengenazo imali kuze kube izinyanga ezinkulu kangaka, ngoba siyazi ukuthi kuyinkinga kangakanani abantu bakithi njengoba kulesi sikhathi esibhekene naso abantu bediliziwe abanye be rely on the UIF money to survive. Indeed, we've also had other companies who've been able to pay workers even half of their salaries while they are waiting for the UIF monies. And we've suggested even to others that if they are able, as you heard the Premier even saying in his statement, that the cash flow is a serious problem in many businesses. But others have been able, even with those constraints, to be able to pay half of the salaries with a view that once the UIF monies are able to pay, at least people will be able then to get their monies. But also from our side, we are really working very hard in trying to support those companies and the workers as well to ensure that they get their UIF monies on time. But we want to be honest to say there is a huge backlog within that office. Thank you.
Thank you. We'll answer the questions and then for us.
No, thanks. I think there are a few issues that one will respond to. In fact, one or two. The issue of taxis which are away from Durban or Pietermaritzburg or the so-called urban areas that are always monitored. We are taking that issue. We will be engaging with the MSC and the taxi industry. We must say that we have a good relationship with the taxi industry. They are working hand in hand with the MEC, and we will want to take that. But it's a call, because if people are raising such an issue, it's a call for us to extend monitoring and compliance program to reach all areas in KwaZulu-Natal. And we will be then doing that and take compliance monitoring to all areas. And we will ensure that the army and the police are going through throughout the province of KwaZulu-Natal to conduct monitoring. The second issue I want to add on is the issue of recoveries. I think MEC, I want to emphasize the point she raised. When you deal with the issue of recoveries in KwaZulu-Natal, you unfortunately not looking at the cases, the new cases, as the MEC is saying. If you look on the new cases are not fatalities, but are people who are infected. Now, on weekly basis, new cases are more than 1,000 weekly. And then recoveries, it takes time because for a people to be tested and confirmed, it will take 14 days. But it will take another 14 days or more to recover. So we must understand that. And you will see that the number will keep on increasing on the side of recoveries. But we will want to request our people to behave. Stop smoking, stop absorbing alcohol, and all of those things. And I think that is important. Let me add on the issue of schools. It is quite important that we consult with school governing bodies, as the MEC has correctly underlined that the school governing bodies represent parents, and they themselves are parents, and therefore we must understand that they are the voice of the parents and we engage with them. It is not that we are just taking risk about the lives of the children. We are mindful of all challenges that are there. We are going to continue engaging with national, including expressing the feeling of the general population, and we will be taking up issues with the national. We know that there is a strong view that says during this winter season, it might be correct and mindful not to bring back learners up until maybe it's mid-August or so. Those are issues we'll be escalating to national and discussing with the minister and with the president. We'll take up those issues with the national leadership. As coastal provinces, we get affected, not only coastal provinces, but whole of South Africa. During the winter season, we need to look on how we mitigate. And I think, though KZN is better than Gauteng and other areas in terms of weather, but the view of the citizens of the province is that maybe it would have been better if we open schools in maybe toward the end or in the middle of August. And we are taking that view. We will raise it with national. Siyafisa ukubonga ithuba lokuthi sikwazi ukunikeza i-update. Kuyakhanyela ukuthi i-COVID-19 iya ngokukhula ey'ndaweni ey'ningi kwi-province yethu KwaZulu-Natal. Sekuphele insuku ezilikhulu, in fact namuhla ikhulu nanye sangena kwi-lockdown njengoba kwakusho umongameli. Noma kunjalo, i-impact ye-COVID-19 iya ibonakala ey'ndaweni zonke. Ngokwesibalo esikhona kuyakhombisa ukuthi wonke ama-district njengamanje are-affected. Ama-cases asebekhona KwaZulu-Natal iyonke angu-13,984, kanti abantu esebedlule emhlabeni bangu-182. Kusiphatha kabi ukubona ukuthi kunabantu abasadinaya befuna ukukhanda engathi asikho lesifo. Bekwenza lokho ngoba bethi abakabona umuntu oke washona noma ogulayo. Lokho kuyinkinga ngoba kunyusa amazinga okuthelelana ebantwini. Siyafisa ke ukunxusa imphakathi yethu yonke ukuthi ikwazi ukuziphatha ngendlela, ilandele imigomo yonke ebekiwe okuwasha izandla ngamanzi nensipho, ukusanitizer, ukwazi ukwenza i-social distancing uma sisey'ndaweni zomphakathi, kuthi uma sikhwehlela noma sithimula sikhwehlelele sithimulele endololwaneni siyigoqile. Ngaphe kwalokho, isimo sithanda ukukhombisa ukunyuka eThekwini naseMgungundlovu and still kwiLembe. iTheku lilodwa sahamba phambili namanje ey'balweni zabantu ababa affected but also nabantu asebesishiyile emhlabeni. Yingakho-ke sinxusa ukuthi sikwazi ukuyivikela kuzo zonke indawo. Ngaphe kwalokho indawo yaseMgungundlovu usuku nosuku isireporta ama-case angaphezu kuka-100 isidlule iLembe, and lokho kukhanda ukuthi sibone ukuthi isimo asisihle. Siyabona ukuthi isimo somnotho sishayekile kakhulu. Indawo eziningi namabhizinisi amaningi neinkampani ezihlukahlukene zikhahlamezekile ngesimo somnotho ngenxa yokuthi kube ne-lockdown nangenxa yokuthi abanye abantu even after simuvele ku-level 3 abanye abantu abakabuyeli ngokuphelele emsebenzini. Umnyango waka-Economic Development, Tourism and Environmental Affairs uyaxhumana ney'nkampani zonke nama-industry ngokuhlukahlukana kwawo njalo at least kanye ngesonto ukuthola i-update. Silekelele labo awungukuthi abakwazi ukuthola i-benefit from ama-relief fund nalabo okudinga bathole izimali zeyinxephezelo noma izimali ze-UIF. Ngokubuyela kwabantwana ezikoleni, njengoba uMinister umama Angie Motshekga indicateile ukuthi abantwana ba grade 6, 11 and grade R kudingeka babuyele esikoleni. Lapha KwaZulu-Natal sibheke isimo sonke sabona ukuthi asikabi sesimene esikahle ukubuyisela bonke abantwana esikoleni. Yingakho-ke sithe kuzoba ugrade 6 no grade 11 kuphela abazobuyela kusasa. Noma kunjalo sizobe siqhubeka sixoxisana nozwelonke ubuholi bukazwelonke ngendaba yokubuyela kwabantwana esikoleni. Siyafuna ukusho ukuthi izwi elisilizwa livela kubantu nje bakwaZulu-Natal, especially ehlaleni emakhaya. Banombono abantu ukuthi mhlambe ngabe kube ngcono ukuthi kulesi sikhathi sobusika besithe ukuthi ukubamba ukuvula izikole sivule mhlambe phakathi noAugusto, so sizokuthatha up sizokudlulisa lokho sikubeke kumnyango kuzwelonke sikudlulisele futhi nakumongameli, ngoba kubalekile ukuthi uma kungukuthi siwuhulumeni wabantu silalele imbono evela kubantu. Umnyango wezemfundo lapha KwaZulu-Natal ngokwengalazinda i-infrastructure usulungiselele ukuthi bonke abantwana ababuyele ezikoleni bakwazi ukuthi babuyele ngaphansi kwesimo esikahle nesiphephile. Abantwana bazokwazi ukunikezelwa ama-PPEs okungukuthi ifonyo nokuyivikela konke, futhi bazobhekwa ukuthi eklasini neklasi kuyaba khona i-social distance. Ngokunjalo kubhekwe ukuthi nokudla abakutholayo bakuthola ngendlela eyiyo. Silibheka kakhulu lolu daba lwezemfundo ukuthi othisha nabantwana nabasebenzi baphephile. Yingakho kusisho ukuthi nathi siphatheka kabuhlungu ukuthi kunothisha abahlanu esebedlulile emhlabeni ngenxa yezifo eyamana noma related to Covid19. Sizoqhubeka sixoxisana naney'nhlangano zothisha nabenhlangano zabazali ngokunjalo nozwelonke ukuthi lesi simo sisingatha kanjani. Kodwa okubukeka kubalekile ukuthi sikusho njengamanje ukuthi isifo se-coronavirus sikhona sikuzo zonke indawo njengamanje. Kusezandleni zethu sonke siwumphakathi. Uhulumeni uyakwenza okudinga kwenza. Uhulumeni uyaqikekela ukuthi okokuqala uyafundisa abantu ngalesifo, okwesibili unikezela lonke usizo lwezempilo kwaba edinga ukutestwa nawudinga abakwarantinwe nokudinga abanikwe ukulashwa. But ngaphekwa lokho lo ukwehla kwesifo kwi-responsibility yomuntu nomuntu ukuthi alandele imigomo ebekiwe nanoma ukuphi indawo kusemakhaya kuselokishini kunanomaphi lesi sifo sesifike kuyo yonke indawo. Sithi sisonke singabantu bakwaZulu-Natal asibamsane sinqobe lesi sifo sokhuvethe i-Covid19. Siyabonga. Well, we must be clear on that issue. We are not contemplating any restriction in any area. We will be planning strategic intervention in areas that are getting affected. Where we see that the situation is getting worse, we will then zoom into that area. And that's why even this week, we had to meet with our war room. We met with the war room to understand proper the analysis and the spread. And as you see, right now we have reported about Umkungundlovu. But our focus and serious attention now is stretching even up to Utukela, because the war room have indicated that these are areas, Utukela, areas that are an entry to KwaZulu-Natal, especially from Eastern Cape, such as Herigwala and Uku. That's where we will be concentrating. But, of course, there are areas that are already leading, such as Tegwini, Ilembe, and Umkungundlovu. So we will not have any lockdown. We are not going to have a stricter lockdown than what we have. The only thing is that we will ensure that people are adhering to all protocols that have been put in place.
Thank you very much. Let me thank the panel, the Premier, Minister for Education, Government Business, Minister for Health, Minister for Education. There are questions, colleagues. I think we can take one. I know there is more for Minister for Education and Minister for Health. We can ask one of them. I will also hand over to the colleagues, some of them that can answer. Thank you. We are general.
Bona la?